My name is Idopase Umana, and I joined the organization in 2009. Initially, I joined at the Brazelton Clinic location, working as a primary care doctor, and totally loved it. And then in 2017, a blessing came into my life. I did not realize it at the time, but I was asked to be the associate program director as we were starting the Internal Medicine Residency program. So under the leadership and guidance of our founding father, Dr. Kruer, I worked closely with him, and we built the program from scratch, brought in our first class in 2019, and as life would have it, the transition has now led me into where I am now, the new internal medicine program director, and I'm extremely excited. I'm excited because I've seen the evolution of the program. I've seen us recruit our first class. I've seen them graduate, match into fellowships, and now be able to continue to be part of this legacy is just truly something that's wonderful. Northeast Georgia Medical Center has a lot of educational benefits within our internal medicine residency program. I would say the biggest thing that I truly love is our core faculty and our subspecialty faculty. It truly takes a village to do what we do, and so having dedicated faculty is an extreme benefit. We have an amazing simulation center where the residents are able to do hands-on and actually be exposed to patients prior to seeing the actual patients. So that's another benefit. I'm also extremely excited about our curriculum. Our leadership team works extremely hard to make sure not only are we meeting the ACGME requirements, but we're also expanding what the residents are exposed to. Like recently in the past year, the residents have had the opportunity to work within the pain clinics, also learn how to identify and take care of patients with addiction disorders. Furthermore, we've got clinics all over, so residents are able to work within the primary care clinics and also within the hospital. The residents of our program train throughout Northeast Georgia. Our flagship program is based out of our hospital in Gainesville, so they also have access to our clinics locally in Gainesville. But outside of that, they also work in Brazelton at the Brazelton location, the hospital there. Some of our residents have the opportunity to work in the clinic. And we also partner with so many other physicians within the community. So within the pulmonary groups, the nephrology clinics, residents go out into Toccoa where they're working in the community. They work in Dawsonville, you name it, they have the opportunity. Along with that, now we are expanding the opportunity for them to do away rotations. So this could take them anywhere if they're selected to do that. So they definitely have a lot of opportunities, and what's so great about our training is when they're done, they can practice anywhere. Candidates should consider Northeast Georgia Medical Center because it is an excellent place to practice. As I noted, I started here in 2009. This was my first job out of training, and I'm still here and probably will retire here. Our residents train here and get the best of everything. They literally have access to all the latest medical technology. They have access to taking care of their patients. They have the support from the clinical team. They are able to consult physicians and get the care that the patients need. Again, we have a simulation center that trains them hands-on before they actually go into the real world. Residents who train here also can practice anywhere. Because they're in a suburban type setting and in the rural setting, they can leave and practice in metro cities and be able to do anything at any time. Along with that, we have great faculty. Again, you can't do this job without having dedicated faculty, and our faculty are committed to internal medicine. Our leadership team is constantly doing process improvement. We take feedback from the residents, from our faculty, and we look at how we can make this program better. We have a strong foundation within our program, and we're continuing to grow. This is an amazing place to practice. This is why I've been here so long. And after our residents are finished, they can choose to stay, which is what Northeast Georgia wants. We want to train and keep our residents.